Welcome to Take Good Care,
an endeavor of Peachtree City Obstetrics and Gynecology.
Our aim and mission is to serve as a source of vital information and discussion for women of all ages,
races,
and walks in life.
I'm Dr. Miranda Williams.
I'm Dr. Deanna Guthrie.
And I am Dr. Karen Green. Welcome to our show.
For nearly 40 years now, the month of October has been designated for breast cancer awareness. And so all over the country, there will be programs and initiatives really hoping to educate and encourage women as well as men to be aware of breast cancer strategies, how to look out for yourself, your family members, and your loved ones. And for years now, my partners and I have talk with patients about various breast cancer screening modalities and what we feel is the best one for early detection. And over the years, thermography has really become an option that some women would rather utilize because of their thinking that it may be less invasive, not as uncomfortable, decrease in radiation exposure. So we thought that this would be a good time for us to give a little discussion on thermography versus mammography, and to talk about what the differences are with them and why the American College of Obstetrics and Gynecology still favors mammography as the screening standard for breast health and breast cancer. So on today's show, we're going to break that down and offer some information that we hope will be good for you to utilize as you you make your own informed decisions about what you would like to do going forward for your own health care. And thermography, which is also called thermal imaging, uses a special camera to measure the temperature of the skin on the breast surface. It is a non-invasive test that involves no radiation. Thermography is based on two ideas. Because cancer cells are growing and multiplying very fast, the theory is that blood flow and metabolism would be higher in an area where a cancerous tumor may be developing. As blood flow and metabolism increase, the skin temperature goes up, is the theory. Thermography has been available for several decades. But there is no evidence to show that it is a good screening tool to detect breast cancer early. And I think that's the fact that we really want to drive home to individuals who are trying to determine what they want to do for breast cancer screening. Again, a good screening test for any disease should be designed so that it detects early disease changes when things can be most treatable. So again, thermography, though it has been around for several decades, there has been no evidence that shows that it is able, as a screening tool, to detect breast cancer early. And again, there was a recent article that was published by MD Anderson that looked at mammography versus thermography. And I'm just going to point out some of that information. And again, regular screening mammogram is used to detect breast cancer early when it is easiest to treat successfully. Patients at MD Anderson in the Houston location sometimes are given information about the differences between these two tests. But it is their recommendation and the only thing they offer as a screening test for as a screening test for breast cancer to be mammography. Sometimes, depending on a woman's study, they may end up getting a 3D mammogram or a tomosynthesis. And again, now Dr. Guthrie is going to talk about mammography in particular and give us information about why it is such a good screening tool Because again, what we're trying to emphasize during the month of October is breast cancer awareness and screening through mammography. Dr. Guthrie?
Thank you, Dr. Williams. So as Dr. Williams mentioned before, a screening test is a test that you do when you're not suspecting any disease, whatever you're looking for, but it is a good test that can, she said, pick up early changes that are most treatable. So a mammogram, it's a low dose, stress the word, low dose X-ray picture of the breast that aids in detection of breast diseases or lesions. Not everything in the breast is going to be cancer. So there are things like calcifications, you can have cysts, you can have little firm tumors that are not cancerous but benign. Just to kind of describe the process for women who have not had a mammogram, you disrobe from the waist up, and you'll have a gown on that opens in the front. And the mammographer will place your breast on a platform, and then another plate comes down slowly to compress your breast, because compressing the breast tissue gives a better picture so they can see lesions. There's a misconception that they just slam your breast into something, but
We've had mammograms.
That's not what happens.
There's no slamming.
During a mammogram, also, you should not wear any deodorant, and the reason for that is that deodorants have metallic substances in them, and aluminum is the most common metal in it. And when you do a mammogram, if any of it gets anywhere on your breast, the metal in the deodorant will pick up as if you have calcifications in your breast, which then confuses the issue, which then makes them have to do more workup when there's really nothing wrong. So that's why they will ask you to remove any deodorant before you have a mammogram done. When you do a mammogram, the screening, so there are two types of mammograms. There's the screening mammogram. That's the test that's done. Again, you're just coming in, nothing is suspected. And when you do a screening mammogram, they take each breast gets 2 images from different angles, and that's the regular screening mammogram. Now, if anything is seen on that screening mammogram, then you elevate up to what's called a diagnostic mammogram. And now that area of concern, they're going to concentrate and take more views of that area. So a lot of women will come in for their exam thinking, oh, it's time for my yearly. I'm going to tell them that I felt something and just get my regular mammogram. That will not be the case. If an issue is pointed out, then it behooves us to then investigate that area. So you cannot have a screening mammogram for an identified problem, whether or not you feel something or something is seen. You do need a more elevated test to find out and to better analyze the area. Dr. Williams also mentioned technology is getting better and better. When we first had mammograms, we actually took pictures like you used to do on film, like you used to have your Polaroid camera. So whenever you had a mammogram done, they stored all your images on film, and it was very bulky. You had to find a place to store them and things like that. But as the technology has developed, we now have digital mammography. The mammogram is performed the same way. It has nothing to do with how the mammogram is performed. So you still come in, you still get your breast compressed and pictures taken. But now we can manipulate the pictures to better diagnose problems. So they can enhance the picture. If there's a spot that looks kind of shadowy, they can, just like how you can do on your iPhone, you can change the picture so you can see it better. You can make it lighter in the background so that they can actually do better as far as diagnosing any lesions. So it's not changing how a mammogram is done. It's changing how the images are developed, and they can be stored as data. So again, much less bulk, so there's no films to carry around. You used to have to go get your films and carry it around. Now digital images can be sent electronically. So you don't have to go pick up your films. And then an added technology is now 3D mammogram that Dr. Williams mentioned. There's tomosynthesis. And so they'll take both 2D, which is regular pictures, and 3D images of your breasts. Again, just a better way of seeing and delineating any lesions. There are 4 classes to your mammogram, or 4 classes to the results when you have your mammogram done. If you do your mammogram and it's normal, it'll read out as a code 1. I'm going to just use the word code 1, and that just means everything looked fine. You come back in a year. There's a code 2 that's also normal. They may see some fibrocystic changes that are all benign, but again, everything is normal. You come back in a year. If you do have to have a diagnostic mammogram, if they look at that area and they think it's probably normal, they will say that, but they'll say, just in case, let's look again in 6 months to make sure nothing has changed. If there was a cyst, it hasn't gotten any larger. And so you'll get a code of code 3, and it says probably benign, and you need a short follow-up. When you have that follow-up, if everything looks the same and looks normal, you'll go back to a class 1 or 2 where you just have your mammograms done every year. And then there's class 4 where something does look suspicious, and then they do recommend intervention, where that be a biopsy or a follow-up with a surgeon for better care. So that's kind of like the breakdown of getting your mammograms every year.
And before Dr. Green goes into a discussion, we found an article about the FDA and thermography versus mammography. The other thing that I wanted to point out is that there are very stringent standards for the mammogram machine,
Yes.
as well as how mammograms are done, and for our mammographers. We have mammography on site at our Peachtree City office location, and Dr. Guthrie is the physician that helps to oversee the management of our imaging area, where we have mammography and pelvic ultrasound available. And we can confirm that it is a very involved, tedious, and stringent process to be certified.
Mm-hmm.
There are quality standards that have to be met every week so that we make sure that the machine is functioning properly, that the images are generated properly, so that the radiologist who is reading these images is able to see what they need to see. Because again, we're going to keep hammering this point home to you, that the whole point of this discussion is that we're talking about screening tests. We want to find something before it is evident, because that is when we can treat for cure. Thermography does not detect cancer in early stages. It does not. Also, there are not any standards for quality or effectiveness that have been determined that can be reproduced time after time after time. Dr. Green is going to go
one
ahead.
point,
Mm-hmm.
just that Dr. Williams was talking about. In fact, our facility, we just passed our.
Yes.
So
Yay.
they're like you said, they're very stringent codes. They're things that you do every week. You have to check your machines every week. They're things that you do every year, and then there's a big one that's every 3 years. And just to let you know how detailed it is, they send out a notice 8 months in advance, because you have to start taking pictures. You have to show all along the way in that 6 to 8 month period of time that your pictures are all consistent.
Mm-hmm.
You have to show that you are keeping up with maintenance.
Mm-hmm.
You have to show that the level of radiation that's there is not too much, So it is a very, very stringent process.
Mm-hmm. Yes.
And so if thermography does not have any of that, there is no, from each facility, you do not know the quality of testing that you're getting done.
Mm-hmm.
Dr. Green?
And so that's really the bottom line. Of course, obviously, we're supporters of mammogram, but it's not just the fact that we have one in our office. It's the fact that we know that it's regulated. We know it's regulated. We know it passes tests. We know that it's going to do the best care for our patients by detecting early disease. Mm-hmm. I cannot say that enough, that when you detect the disease early, it's a greater risk of cure. 1 in 8 women will develop breast cancer. That number hasn't changed no matter what we do. It's going to happen. And most of these women aren't going to have a family history. And so saying that, well, my breasts feel fine and I don't have any family history, 1 in 8 women develop breast cancer. Mm-hmm. So if you want to do something that's going to give you the most chance of surviving potentially a disease that you didn't realize you have, you want to do the best tests. And so the FDA, of course, has to get involved when it comes to things that may be misleading. Mm-hmm. As we've said before, mammogram identifies tissue types with different densities. Thermography shows patterns of heat on or near the surface of the body. There is no regulation of how these machines are detecting these patterns of heat. And does a pattern of heat develop when there's an early stage disease? There is no scientific evidence that that is the case. And so the FDA in this particular article wanted to remind us that mammogram, the low-dose X-ray imaging of the breast, is still the most effective primary cancer screening test. They're not aware of any scientific evidence to support the claims that thermography is a proven alternative to mammography. One of the greatest dangers from mammography is that those people that opt for that method think that mammogram might hurt, so let's just check the heat. But they're going to miss the chance of actually getting something early on by looking at just color patterns. They actually show a picture on the particular article of the difference between the two. So if you're actually looking at, mammograms here and thermographies here, the mammogram is actually detecting, this could be a calcification, this could be a cyst, this could be an actual palpable lesion. Thermography is just showing heat changes. And that's part of the problem, that there's really no standard. So when our mammographer, when the radiologist looks at a mammogram film, the digital film, they're looking to see what those changes are. They're actually looking to see, okay, this might be suspicious, going whether or not it's a stage 4. It might be something that we can follow, a code 3, but they actually have regulatory standards. Thermogram doesn't have that. And so one of the reasons that, the FDA is concerned is the fact that, people are being missed. They're getting their thermograms year after year. And we have patients that come in and say, well, I had a thermogram. And so I have to tell them the same thing. Thermogram isn't regulated. There's no scientific evidence. The place that you go to may be different from some other place. The FDA has even taken stringent steps to keep people from actually getting thermograms by sending letters out. Because they are a regulatory commission, it's not like they can actually do anything to stop them. All they can do is let them know that this is not right, this is not something that we support, this is not detecting disease. Women seek thermogram because it's painless. Mammogram isn't that painless. It is uncomfortable. I think that uncomfortable is worth it when it comes to detecting something early.
Exactly.
And everyone thinks
and it doesn't take a long time.
It really doesn't. You go in, as Dr. Guthrie said, you have your breast compressed. Your breast is compressed, but it doesn't hurt. Some people think, well, my breasts are big. How are they going to see anything? Because it's a regulated machine that actually can detect breast cancer in any size breast, big or small. It doesn't matter. The bottom line is talk to your healthcare provider. Talk to your healthcare provider about what your risks are. Talk to your healthcare provider about what your concerns are. Because if it is a concern that I am doing something that's going to hurt me less and that's why I don't want to do it, if you ask the facts, if not us, somebody else who's going to recommend why mammogram is better, why you should have mammogram, the facts behind, the data behind the mammogram that we can actually go over with you so that you have a little less reservation about having the mammogram.
2 points. And it's not to say that you can't have a thermogram done. It's just that it is not a standalone test to detect breast cancer.
Early disease.
So for early disease. That's the point, again, that we want to make, that some women, like Dr. Green says, will choose only to get a thermography and then feel like they can rely on that. There was a statement that says it can be used as an adjunct test, meaning that if there's something abnormal on a mammogram, if you wanted to get a thermogram to see if that area does light up, you can use it that way, but not as a standalone test.
Exactly.
Also, another concern women have is about radiation. So mammograms have slightly more radiation than a regular chest X-ray, but I read an article where it says, but it's less than the radon that you are exposed to in your home.
Right. That's the thing.
So that's another concern about
safe.
women.
They're not
So
unsafe.
you have radiation all around you every day. It's a concentrated dose because you're getting it right at that one time, but it is less than the overall radiation that you are exposed to at your home. They also compared it to everybody is exposed to, they said, about 3. There's a unit of measurement. It's called a milli. Hang on, let me look. It's a millisievert. That's the unit of radiation. A mammogram is 0.4. The average exposure for a year for the average U.S. citizen is 3 of these units. So they're comparing it to that. Getting a mammogram done is if it's like 7 weeks worth of radiation, but you get it at one time and that's it. And then it's still less than what you're being exposed to at your home. So
Right.
you're not going to start glowing in the dark when you get a mammogram done.
Right. And the reason we really wanted to bring this out and talk about this in detail is, again, I think you all know who've listened to us in previous seasons or who are our patients. We are heavy proponents of patient education and giving you information so that you can make an informed decision. We're not here to tell you what to do. We're just here to provide you with the information that we feel is grounded in science and fact and reproducibility. And so that is why we wanted to highlight the issue as it relates to thermography versus mammography. Again, as the article and the representatives of MD Anderson mentioned, even if a patient comes in with an abnormal thermogram report, then they have to get a mammogram because you cannot base any treatment decisions or anything based on the thermogram because it is not a regulated standard of care for the detection of early disease or for following any disease processes once they have been managed and treated. So this is to provide the information so that you can make an informed decision that mammograms are safe. The amount of radiation that you're exposed to is minuscule in comparison to other things that we're exposed to every day. Mammograms may be uncomfortable, but as Dr. Green mentioned, to be uncomfortable for a few seconds, getting a mammogram that will help me to detect anything early that I can then get treatment for cure, I'm okay with that, as opposed to having to deal with potentially a lifetime of disruption in my lifestyle or lifespan because of undetected disease. Again, we're all women, we're all of mammogram age, and so we've had mammograms, and so we understand that there may be some discomfort and some hesitancy, but this is something that we also do on a regular basis. I've had mammograms every year since I turned 40. I've never had an abnormal mammogram, thank goodness. I don't know if my partners want to talk about, we understand that, having a test can be anxiety provoking. And if you get that call back to say, well, we see something, we think we need to get some additional studies, that can cause you some anxiety, even as a physician, even as a healthcare provider. But that's the point. We're trying to find if there is anything there that needs to be addressed, find it early so that it can be taken care of. Do you all want to talk about your experiences at having to?
Well, I got a call back on my last mammogram. And of course, yes, you're nervous. You're not sure, is there something really there? But you have to keep in mind that that was the reason for doing the test. I have people who say, well, they said my mammogram was abnormal, and then when they did everything turned out fine.
That's
what we want.
Yes, that's the point.
So that it's not that the mammogram was wrong. It's just that if there was something there, they would have found it early to take care of it. So that's what you have to keep in the back of your mind. And that's what I kept telling myself,
right,
that this is the whole reason that if there is something there, then I want to know,
right,
and I want to take care of it.
Right.
Because
we get nervous. We're human.
And I want to take care of it early.
Right.
Mm-hmm. I've probably gotten about 3 callbacks. It's like every other year, every other breast. And a lot of reasons that you get callbacks or something is different is because of breast densities. Younger women have really dense breasts, and some women have really, really, really dense breasts. So even with the compression, they see something, they're not really sure what it is. They want to do a highlighted view of one particular area to see what that is. So first callback, was probably 10 years ago, and I was like, oh my God, And I have a family history of breast cancer, so of course my mind went there. So I get it. I get it. My mind went there, and I'd already planned my double mastectomy. And I remember not telling my husband that I had a call back because he would go into overdrive, and so I was like, I'm just going to go get my additional study, and everything's going to be okay. Talk myself off the ledge, and it was. It really was. And so the next year, mammogram was fine. The year after that, got a call back, and I was like, okay, And I always tell myself that as a physician, you are still human and you still have those same feelings that your patients do. And so I get what patients feel when they think, another callback, but it was okay before. Why do I have to do it? And I had the whole conversation in my head. And then I laughed at myself because I thought, well, if I was the doctor listening to this conversation, I'd say, because that's what the mammogram's for.
That's what it's designed to do.
So I went in and I got my, I got my additional views and everything was fine. The next year, everything was fine too. And then I think the third callback, I said, I've got dense breasts. Maybe I need to do a different type of mammogram so I don't get the callback, so I don't have the anxiety. Now, that being said, when I have my mammogram this year, because it's on the off year and last year's 3D mammogram was normal, if I get a callback, I'm still going to have that conversation in my head.
Yes.
But I still will go back and do the additional mammogram if I need to.
And you get your annual mammogram. It
do.
doesn't keep you from
It
getting the
doesn't keep
test.
me from being it,
Right. And so I think that's the point that we really want to drive home, that a screening test, any screening test, but we're highlighting mammogram as a screening test for breast cancer, is designed to detect early disease. So you may get callbacks because they see something that is abnormal that requires additional study, and that means it's a good test. It's a good screening test because it is doing what it is designed to do so that we don't miss anything. And again, we want every woman to be informed about their decision. And I have patients who just refuse to get a mammogram and who may say they only want to get a thermogram, and if it's abnormal, then they may do something. If that is your decision, I want it to be an informed decision so that you understand that the test that you are choosing to have is not designed to detect an early process. It's just not. It's not regulated in a way that it can be reproduced so that from year to year to year, you can compare different images to see if there's something changing. If there's something abnormal seen on a thermogram, then you have to get a mammogram as the next step in terms of imaging. So we just want you to have the information to know what the facts are based on these different tests and how they're designed and how they're used. So we, in all of our episodes and with everything we do with our calling as being physicians, we want you to know your options. We want you to know yourself. We want you to advocate for yourself. But please, if you have questions or concerns, we want you to go to respected resources. We want you to talk to your healthcare provider or find a healthcare provider that you can talk to provide you with information. You can also go to other resources, health departments, the Komen Breast Care Hotline, and Komen is with a K, Komen, and that hotline number is 1-877-GO-KOMEN, 877-GOKOMEN. CDC.gov also has a wealth of resources. We know everyone is Googling, and you can find a resource for everything, but check the validity and the history of who you're getting your information from so that you know that it's something that you can rely on it because your life depends on it. This is about your life and your quality of life.
Yes.
Should something be detected. Ladies, any other comments you have?
Get screened.
Yes, we can't emphasize it enough. And even for those patients that come in and either decide not to have a mammogram or decide to have a thermogram, we're going to give you the information. We have to give you the information because it's personal to us. As women that have had mammograms, as women that have known people that have gotten breast cancer, it is very important because it is treatable in its early stages. Mm-hmm. And so being that the mammogram will detect it in the early stages, we want people to get it.
Yes, absolutely. So once again, we appreciate you taking your time to listen to us. We hope that this information has been helpful, has been informative, and we again always want to encourage you to be your own advocate for your health. Please share us with your family and friends. You can always visit our website at ptcobgyn.com. Listen to us wherever you get your podcasts. And until the next episode, I'm Dr. Miranda Williams.
I'm Dr. Deanna Guthrie.
And I'm Dr. Karen Green. Take good care.